Now on Skype to discuss these claims of fetal experimentation at the University of Pittsburgh is Dr. David Prentice, Vice President and Research Director for the Charlotte Lozier Institute. Dr. Prentice, welcome back to the show. What's your reaction to the Center for Medical Progress's claims about the University of Pittsburgh?
Well, Catherine, sadly, it's not surprising, given the University of Pittsburgh's unethical history with fetal tissue research. And it's also sad that the Center for Medical Progress and Judicial Watch had to struggle to drag this disturbing information to light, and troubling. Because the documents are so heavily redacted, you have to wonder, what was the University of Pittsburgh doing that was so awful that they and the National Institutes of Health had to hide it with redactions and bureaucracy?
Does the Charlotte Lozier Institute believe these claims deserve a deeper investigation? Could you speak to the facts and the science of this case?
Well, these heavily redacted documents hide so many details, but because one method of abortion that's listed is labor induction, there is the distinct possibility that some of these babies were born alive and then their organs were harvested for experiments. Yeah, there's so many questions raised by these heavily redacted documents that the University of Pittsburgh and NIH owe the American people clarity and transparency. If there's really nothing to hide, then provide those details.
Dr. Prentice, this really is a complex topic, but why is this topic of fetal tissue harvesting one the pro-life movement should be paying attention to?
Well, it highlights the continued abuse of science and the trafficking in aborted baby hearts, brains, kidneys. Not only is this gruesome and ethically abhorrent in terms of its practice, it's medieval and ineffectual science. There are modern alternatives, ethical, successful scientific methods like adult stem cells, which have treated over 2 million patients already, that we don't need to go there in terms of fetal tissue research or anything related to the gruesome practice of harvesting and trafficking aborted baby body parts. You know, we'd begun to see the decrease of taxpayer funding and redirecting those funds to ethical research, for example, with the Ethics Advisory Board that met last year about this time. But now the Biden administration has removed any ethical review. So we need continued vigilance to keep the light on this and to put pressure to stop this horrific science.
It's a really important point. Dr. Prentice, can you speak to David Daleiden and his leadership and the impact that his investigative work has had so far?
His bravery must not go unnoticed. David Daleiden's impact is demonstrated by the fact that he was not just prosecuted, he was persecuted for his undercover investigative journalism. And it led to admissions by Planned Parenthood officials about the harvest and sale of those baby body parts. And of course, Planned Parenthood doesn't want to admit to trafficking in aborted baby body parts, nor does NIH want to admit to using taxpayer money for such atrocities. And of course, University of Pittsburgh doesn't want to admit to targeting minority babies for horrific, painful death to harvest their organs. So David's undercover work is vital in bringing the truth to light.
As we wrap up this segment, I do just want to note to our viewers, it is important to note that we did reach out to the University of Pittsburgh for comment, and we have not heard back. Dr. David Prentice with the Charlotte Lozier Institute, thank you as always for your expertise and your insight. Thank you.
Thank you.